Hello, my name is Pharand, and today I will be demonstrating a subcutaneous injection. So to start, we're going to look at our scenario that today is February 7th, 2021, and the time is 08:25 in the morning. So to start off, we're going to start with our first check by comparing our physician's orders to our MAR. So we're going to look at the patient's name first, Jake, nursing. So FIN number 312-654-987-987. Date of birth, January 1st, 1960. Dr. Skills Lab. So we can see that our patient has no known allergies, and our medication are metoclopramide, 5 milligrams, subcut, daily, and this to be administered at 0800, and it's 08:25 right now, within the half an hour time frame, and it has not been given yet, so I'm going to give this medication. Our other medication we have here is diamond hydronate, 150 milligrams, IM, daily, and this to be given at 2100, so we will not be giving this medication right now. I can see that all my medications are double transcriber signed. So now we can set aside our physician's orders and we can take a look at our drug monograph. So our drug monograph for metoclopramide is that it is an antiemetic, mainly for nausea. Its maximum single dose is 20 milligrams. We are only giving 5 milligrams, so we're well in the safe dose to give, as well as says that it can be administered subcutaneously as long as it's undiluted, which it is. So we are good to go. And now that we have this information, we can set our drug monograph aside and we can gather our supplies. We'll start with our medication. So I'm going to wash my hands here and I'm going to grab my medication and check. So metoclopramide here. So I'm going to check metoclopramide and 5 milligrams. And here we have 10 milligrams for 2 ml. So that means we're going to need 1 ml to get the desired 5 milligrams that we need. And it is to be given subcutaneously. And this is IM and IV. However, we did check the drug monograph and it says that it is able to be given subcutaneously, so we are good to go. So we will be using this metoclopramide for our procedure today. Now that we have the medication we are going to be using, we will gather our supplies as our needle and syringes that we will be using for this demonstration. So for this demonstration, subcutaneous injection, we will be using a 3 milliliter Luerlock syringe. We're going to be using a blunt fill needle, as well as we're going to be using a 27 gauge half-inch injection needle for this subcutaneous injection. So now that we have all of our supplies that we're going to need for the procedure, I can start off by grabbing my syringe, opening this, and grabbing my syringe. And now that I have my syringe, I can grab my blunt fill needle, and I'm going to attach the two. All right, now that the two are attached, I can set this down right now. I can throw that away and I will grab my medication vial. So I'm going to check it's also not expired. And it's the right medication of metoclopramide, and I'm going to grab a alcohol swab. And we are going to swab the top of this vial, cleaning it for about 30 seconds. We're going to be swabbing it. So, right, we're going to say that that's been 30 seconds that we've been swabbing it. So now we can just throw that in the garbage, and now we are ready to inject. So we saw that we needed the 1 milliliter to get the 5 milligrams we desire. So we'll be pulling up 1 milliliter of air to inject into the vial. So now I can uncap my syringe and inject air into the vial. So I'll start off by injecting my air and then pulling up 1 milliliter of fluid. Okay, and now that I have my 1 milliliter that's desired, I can recap my syringe. And here I'm going to grab a pencil or pen or something hard. Can you just grab me a pencil? So I'm going to grab a pencil and I'm going to knock any excess bubbles out of the syringe. And once all the bubbles are out, I'm good to go, and I can remove my blunt fill needle. So I can remove this and deposit it directly into the sharps container. So that will go in sharps, and then I'm ready to grab my injection needle. So I'm going to grab my subcutaneous injection needle here and opening it. And then I'm going to attach the two. Perfect. And now that I have attached the two, I can now prime the needle. So I'm going to prime it up just so we see a little bleb at the top, and we have the exact desired 1 milliliter that we want. So there we have a little bleb. And here we have the exact 1 milliliter that is required in the syringe with no bubbles. And now I can set this down and right away create a medication label for it. So I'm going to start and write the initials, so JN for Jake Nursing, and the drug metoclopramide, and then the dose is going to be 5 milligrams for 1 ml, because the concentration we see is 10 milligrams for 2 mLs. So the concentration 10 milligrams for 2 mLs. The date is February 7th, 2021, and the medication is to be administered at 0800. And then my signature, C. Pharand at UMSN2. So now that I have my label made, I have my label ready to go, I can move on and perform my second check. So I'm going to grab my MAR, my label, my syringe, as well as my vial, and I'm going to start with my second check. So I'm going to look at the name, so Jake Nursing, JN for Jake Nursing. The drug is going to be metoclopramide, and we can check here, say metoclopramide. It is 5 milligrams, and 5 milligrams, which is 1 ml, which I can make sure that I have my exact 1 ml in my syringe, which I do with no bubbles. And then when I check my concentration here, it's 10 milligrams for 2 mLs, which is how we know we need the 5 milligrams per ml. So now that we have the dosage, we're going to look at the route. So this is to be given subcutaneously, and we have our subcutaneous injection needle ready to go, as well as on our vial. It says that it can be given IM and IV, but we did check the drug monograph, and it says that it is able to be given subcutaneously. And it is to be given daily at 0800 and 0800. Which is 08, and it's 0825 right now, so we're able to give this medication, and our second check is complete. So now that our second check is done, we are going to get ready to move into the, go into the patient's room, so we can put away our medication vial and grab our supplies. So for this injection, I'll grab a cotton ball, a alcohol swab, and our gloves, our clean gloves. And I'm going to move into the patient's room. So when entering in the patient's room, I'm going to perform an initial safety check, make sure there's no hazards or anything concerning, and in this case there's not. So I'm going to first off introduce myself, say hello, my name is Cameron Pharand, and today I'm your student nurse from the University of Manitoba. And after I've introduced myself, then I'm going to check the patient's armband with my MAR. So I'm going to ask to see their armband. I'm going to look at their name, Jake Nursing, and their date of birth, January 1st, 1960, and their FIN number, 312-654-987-987. So then once I've checked their wristband, I'm going to verbally ask them if they can state me their name, so they'll say Jake Nursing, and their date of birth, January 1st, 1960. So once they have told me that, I'm going to ask them as well if they have any allergies, and in this case, he's going to say that they have no allergies, which matches our MAR. So we're good to go with that. So then right away, I'm going to tell them that I'm just going to do my third check. And so I'm going to grab my label, my syringe, and my MAR, and I'm going to do a quick third check. So I'm going to look at their name first, Jake Nursing, JN, and then the medication we are giving is metoclopramide, and dose 5 milligrams in 1 ml. So we can check that we are still 1 ml in our syringe, which we do. And after the dosage, it's to be given subcutaneously. We have our subcutaneous injection needle ready to go. It is to be given daily at 0800 and 0800, and it's 0825 right now, so we are good to give this medication. And now that our third check is done, I'm going to educate the patient a little bit. So I'm going to say that they will be receiving metoclopramide, which is an antiemetic for their nausea related to chemotherapy, and that some side effects they might experience are dizziness, drowsiness, any possible headaches. So if they experience any of those side effects, to let me know right away so that I can assess further into them. And that the things I'm going to be assessing beforehand is I'm going to be checking their vital signs, I'm going to be monitoring their level of consciousness as well as their state of nausea. And once I've checked all that, I'm going to select my site of injection. So for this subcutaneous injection of only 1 milliliter, I'm going to be injecting into the abdomen. So to landmark for this medication, I will be finding their umbilicus or their belly button, and I'll be going 5 centimeters directly out to the side. So kind of in between the upper and lower right quadrant. I'll be going directly 5 centimeters away from the belly button. So once I have landmarked and chose my injection site, then I am ready to go. So I will start off by putting my gloves on. So I can set this aside and I'll put on my clean gloves. And once I have my gloves on and I have I'm ready to go. I'm going to grab an alcohol swab and I'm going to clean the area that I have chosen in the abdomen here. So I'm going to clean working in a circular motion outwards for 30 seconds. So then we're going to say that that's been 30 seconds, then that can just be thrown out. And once it's had time to dry here, we're ready to inject. So we can uncap our needle, and once our needle is uncapped, then we will, for this subcutaneous injection, we'll be injecting at 45 degrees, which means we need to pinch 1 inch of skin. So we will pinch 1 inch of skin, and then once we have pinched it, we will make sure our bevel is up, and we will inject directly into their abdomen, and then stabilize our syringe, inject slowly, and then once our medication is injected, remove our fingers, remove the needle, and we will activate our safety right away, our safety mechanism, and deposit it directly into the sharps. And now that that is deposited away, if we need, we will hold the cotton ball. In this case, we don't. So then once that injection is completed, then I will tell the patient I'm going to monitor them. I'm going to check their vital signs right away. I'm going to continue assessing their level of consciousness as well as their states of nausea. And then once that has been completed, I'm going to document in my MAR that I've given the medication. So for this medication, it is going to be given at 08:25. And then it is by my initials, CPUMSN2. And after, once I've documented, I'm also going to remove my gloves. I'm going to wash my hands. And then once I have documented that I did sign off my proper medication in the right time and right slot, then I have, I'm ready to do my final exit safety check. So I'm going to make sure that the patient is in a safe, comfortable position with the call light in place, the bed lowered, and that there are no hazards in the way. And in this case, we're all good. And then once I have done that, I'm going to go document in the MAR how the patient tolerated the procedure, their levels of nausea, as well as their vital signs. And once I have documented, that's the end of the procedure.